So we've got testosterone, Anavar, Ozempic, Clenbuterol. These are all highly coveted and highly popular performance enhancements within the fitness industry and within the sport of bodybuilding. But what are the starting doses of these enhancements and why do people use them? This video is not medical advice. It is not a recommendation to start any of these enhancements, and full disclaimer, you should treat it as a video for entertainment purposes only. It is purely informational. Always follow the law. Always consult medical professionals. Only do so under the correct supervision, and understand that there are real and substantial risks with all of these enhancements. And locking in as number one, testosterone. In the medical setting, in a medical context, and even within our sport, this is one that is often used as replacement therapy to support natural testosterone levels. It is an anabolic steroid, and it's one that isn't specific to just men. Women make testosterone too. And women suffer tremendously from having low testosterone levels. Now, the common starting dose for males using testosterone for testosterone replacement therapy is 100 to 200 milligrams per week. Now, when we look at the female starting dose, this is going to be much, much less. We're talking 3.5 milligrams per week. That is the starting dose for female testosterone replacement therapy. Not 10 milligrams, not 20 milligrams per week, 3.5 milligrams per week. And if we break that up into daily dosing, which I highly recommend, that is 0.5 milligram a day. Now, global risk and caveat for using testosterone replacement therapy, otherwise known as TRT HRT, is you have to understand that as a male, there is a point in which too much testosterone can actually be a problem for you. Testosterone is going to aromatize into estradiol. It's going to raise your estradiol levels. And for some men who are kind of on the lower side, this might not be a bad thing. But for men who are starting TRT and have normal to even normal high levels but are not symptomatic, this aromatization can be problematic and can impact sexual performance. And if that wasn't enough, the aromatization of estradiol, excess estradiol in males, can lead to gynecomastia, which, if not addressed immediately, and I say immediately because you should get on it immediately, but I mean, granted, there is some time depending on the rate at which you're aromatizing, this could eventually require surgery. What about for females? Well, this is a different kind of conversation, but we need to understand that testosterone being an anabolic, there is a point in which you are at risk for developing masculinization. So virilization, androgenic effects, which it's in the name, anabolic androgenic steroid, yet this is, I would say, broadly thought to be something that most women who want to continue to stay women are not looking to incur. Virilization includes changing of vocal pitch, vocal depth, clitoromegaly, as well as hair loss, hair growth, acne, oily skin, which, again, if not addressed relatively soon, can lead to permanent scarring. Now, for women, we need to be cognizant that serum testosterone levels are not going above 100 nanograms per deciliter. For men, we need to also take a closer look at the relative ratio of testosterone to estrogen, as well as be on the lookout for any symptoms, any manifestations of high estrogen. Next up, we have Anavar. This is coined as the female steroid, the female PED, and it's gained a lot of popularity in the last several years. Now, why is this touted as like the female steroid? It has a lower androgenic to anabolic ratio than other anabolics. Simply put, there is less likelihood of it causing virilization, not no likelihood. There still is always a risk. And with prolonged use at an excessive dose, which is probably less than you think. So why is this thought to be female friendly or potentially even risk-free for female athletes? That's because the androgenic to anabolic ratio is much, much less compared to other anabolics. Now, with that being said, it is not risk-free. It is not something that you can take even at a low dose indefinitely. And I would really say past the point of 8 weeks, even at a low dose, you really have to question, why do you have it in place? And is it yielding the result you were hoping for? Now, starting dose for females using Anavar is 2.5 milligrams a day. This is to be taken 1 hour pre-workout alongside caffeine, but it needs to be something that we respect. Are we in a position to actually take advantage of its ability to create anabolism? Because frankly, that is the primary use for an anabolic for female athletes, is to drive muscle growth. And in the instance that individuals may be using it for fat loss, I think you're going to be highly disappointed to find that it's not going to directly move the needle nearly the way you're probably hoping it will. Now, when we look at what doses we could escalate up to, this is simply going to come down to what kind of risk tolerance do you have? Because Anavar is an anabolic, we have to respect the fact that a greater dose and longer duration of use does come with a higher risk of utilization. Same idea with testosterone. So what is the thought process with escalating the dose? Ultimately, this is going to come down to what is your risk tolerance like? With the use of Anavar, we have to respect the fact that we don't get to pick and choose. It's not a buffet. If we're hoping for anabolic effects from an anabolic androgenic steroid, we are also readily accepting that there is a potential for androgenic effects as well. A lot of women are going to get a lot out of 2.5 milligrams or 5 milligrams, but sourcing Anavar can be difficult. It's something that you want to ensure is actually Anavar if you're going to put it in place as a female athlete. Now, I'm hesitant to even go into the male side of things, but I know that's what you want to hear. Male starting dose for Anavar. This is going to be controversial, and some of you are going to lose your mind, but men can get really good results from 5 milligrams, 10 milligrams of Anavar, even in the space where we're looking at athletes who are looking to really progress their physiques. Now, just because someone uses more doesn't necessarily that they yield 2x, 3x, 4x the results. And we have to understand with something like Anavar, because it is an oral anabolic steroid, it does come with systemic effects as well. It is going to be mildly hepatotoxic, so it's going to cause elevations in liver enzymes. It also is going to cause some degree of dyslipidemia, so it's going to decrease HDL and increase LDL. What you need to understand is that even though it does have a mild profile in terms of its androgenic to anabolic ratio, it is not risk-free. Next up, we have Primobolan. It is also a DHT derivative, meaning it's in the same steroid family as Anavar. It's often praised for driving less water retention and fewer unwanted effects for both men and women. Now, here's the reality. If you talk to any bodybuilder or anyone who thinks they're a bodybuilder who is enhanced, you're going to hear really hefty doses for these injectable anabolics, and frankly also for oral anabolics like Anavar. For individuals who are risk averse, for female athletes who are looking to incur the least amount of utilization, starting dose for Primobolan would be 15 milligrams a week. Sure, there could be an argument to be made to escalate up from here, but strongly recommend starting at the lowest dose possible and only exposing yourself if you're able to get everything out of it, i.e. muscle growth. Now, what about for males? What's a starting dose of Primobolan? Well, this is going to be in conjunction with testosterone, as it would be for a female athlete if needed. But for men specifically, if you're going to be running Primobolan, a very humble starting dose, a modest starting dose would be 100 milligrams per week. I've had individuals who've started at 75 milligrams per week in conjunction with TRT. They've gotten great results off of it. I've had individuals start at 150 milligrams per week. Yes, there is room to escalate, and these are truly the lowest dose possible that I would recommend. Really, what you have to consider is, why is it being put in place, and are you willing to potentially put yourself at risk for, in the case of a female athlete, hormonal dysregulation, because being an anabolic, it will have suppressive effects on HPO function and potentially virilization. Primo can be hard to come by. It's not something that is prescribed, so you're likely going to be having to source via UG and non-prescription, and with that does come issues with quality. Now, I would highly recommend, if you're going to go that route, it would make the most sense to get a testing kit, to talk to referrals who have also used the same source, who are of the same gender, and within that, making the determination, is it worth rolling the dice? Now with Primo, what I have all my athletes do is First, there is an established threshold for their testosterone levels prior to starting Primo, which, spoiler, if you're going to be using anabolics, I strongly recommend that you have TRT in place at least during that duration. That is in the case that it's not needed outside of that duration. Now, for all my female athletes who are going to be using Primo, I like to know where their testosterone is prior to starting Primo. Once we put it in place, I want to retest testosterone levels because Primo can sometimes be faked for testosterone. Sometimes you're not getting and putting in your body what you think you received. Now with that, we shouldn't see this vast elevation of testosterone once starting Primo. We really shouldn't see any kind of difference. So if that's the case, if you were to start, let's say at 15 milligrams a week, that would cause a noticeable shift in testosterone levels if it was testosterone and not actually Primo. So even though it is an injectable anabolic and we're not going to see that same impact on liver health, on hepatic function, we still need to consider the impact on hematology as well as cardiovascular function. So if you're not versed on how to read blood work, if you're not versed on how to assess a panel, that's something that I work with clients on a one-on-one basis with. Even if they have a coach, bring your coach in. We can all assess, all look at it, just to ensure that there's nothing glaring prior to starting using that anabolic. And I guess I should specify this. Why are we using anabolics to begin with? They're really good at building. So Anavar, Primobolan, yes, there are other ones, but these are two that I would say are very popular and ones that I see a lot with my demographic. The primary purpose of using them is to build muscle. It's not to lose fat. So if you're using Anavar or using Primobolan and hoping that you're going to lose more belly fat, you are going to be mistaken. That is not what these things are good at doing. What about Clenbuterol? Clenbuterol is a bronchodilator. It is a beta-2 adrenergic agonist. It is going to increase your heart rate. It's going to bronchodilate, which arguably could help you burn more fat in that you're going to perform better in your cardio sessions. Now, off-label in the bodybuilding space, in the fitness space, it is used to increase fat loss. Now, the starting dose is 20 micrograms. And for some people, they might find that this is still too much because some of what you're going to experience is a little bit of a sympathetic effect. You're going to probably notice within the first couple of weeks, slight hand tremors, jitteriness, and it should go away within the first 2 to 3 weeks. This is something that a lot of people report. Initially, it's very intense, but with extended use, this does dissipate. However, its fat loss properties do not dissipate alongside the sympathetic effects. 20 micrograms is where I would start. Even if you're on a tight deadline, you want to double it, start at 40, you're still within a very reasonable dosage for Clenbuterol. Now keep in mind, it is not FDA approved for this. And really what we have to weigh in terms of assessing whether or not it should be in place and at what dose, whether it should be 20 or if we can escalate up further than that initially, is the overall impact on recovery and whether or not it is actually generating more fatigue that then needs to be managed. There are some individuals who are very sensitive to even 20 micrograms, and for them, this did impact their sleep. And if that's the case, I would probably recommend scoring that even further, so maybe starting at 10 or not using it altogether. If something like this that does have a longer half-life, it is a 36-hour half-life, if it is impacting your sleep or making it to where you can't actually recover, well, it's kind of a net zero in the end. But in the case that you want to use it to stimulate a little bit more fat loss, a little bit faster, I think it could be adequately introduced in a fat loss phase. So what about growth peptides? Now, you're probably hoping that I go into BPC, TB500. It's not going to be this video. Stay tuned for a future video specifically on those. But when I'm looking at growth peptides, something that is going to aid in hypertrophy, fat loss, as well as both protein and collagen synthesis, I am going to lean towards growth hormone. Now, this is assuming that you have access, and this is not something that you're likely going to be able to obtain with a prescription. The starting dose for growth hormone, men or women, is 1 to 2 IUs a day. Yeah, if you want to go to 2 IUs, you can afford it, and you're very pleased with the results. It's still within that, I would say, generally safe profile. Now, keep in mind, you'll see online a lot of people tweeting 4, 6, 8, 10, and so on units per day. We have to be cognizant that with growth hormone does come the increased growth factor, as you would probably presume. Now, for individuals who have comorbidities, if you are suspicious of potential cancer, if cancer runs in your family, if you've previously had any kind of question around a mass or suspicion of a mass, this is all something I would take into consideration as to whether or not it makes sense to have growth hormone in place. Because albeit growth hormone in itself isn't going to cause cancer, it is going to increase your risk if you are already at risk. So the analogy I like to use is if you take someone who is a smoker, they inherently are going to be at a higher risk of developing lung cancer just based on their lifestyle choices. This is something that should be weighed against and should be individualized in that decision-making process. But 1 to 2 IUs would be the starting dose if you do plan to leverage growth hormone. Now, what do we need to know about it outside of its potentiation of growing cancer cells? There is going to be an increase in blood glucose. So for individuals who, let's say, are on the cusp of being pre-diabetic, this needs to be considered, and perhaps we look at some other form of polypharm in order to even that out. So we also need to be mindful that growth hormone is going to increase blood pressure. Now, to what degree? It's largely going to depend on how much you take. But with this, we need to understand that if someone is already in stage 1 or stage 2 hypertension, there needs to be something in place that supports the management of this increase in blood pressure. Next up, we have injectable L-Carnitine. And yes, injectable, because frankly, the oral version is really shitty in terms of bioavailability. Injectable is something that can readily be accessed and administered seemingly pretty easy, but if you have a fear of needles, this one might be off the table for you. Starting dose is going to be 200 to 400 milligrams per day. Now, insulin needs to be present for this to work, meaning do not take L-Carnitine, do not take injectable L-Carnitine fasted. Take it prior to your workout alongside your pre-workout meal if you're able to. Next up, we have Yohimbine HCL. This is an alpha-2 receptor antagonist. It's going to increase lipolysis. It's going to increase fat loss. It's going to increase blood flow to, let's just say, stubborn body fat. Now, what you need to be mindful of is that Yohimbine can increase both anxiety and insomnia. So for individuals who already run kind of anxious, this might be one you want to really pay attention to the starting dose. Now, depending on the quality, depending on the potency, I would start anywhere from 2 milligrams a day to 0.2 milligrams per kg, Telmisartan. Now, if you yourself have dealt with issues with hypertension or your family members have, then you might be familiar with ACE inhibitors and ARBs. Telmisartan is an ARB. Look at the suffix, so same drug class. Now, in the medical setting, it is prescribed for hypertension and cardiovascular risk reduction. However, in terms of hypertensive medications, this is one that can have benefits from an athletic standpoint. Now, Telmisartan, where it really shines, is working through the PPAR pathway. It can stimulate insulin sensitivity, it can lower glucose and increase lipid uptake, and this is occurring in peripheral organs, so specifically skeletal muscle, liver, and adipose. Now, why Telmisartan over other ARBs? It has a longer half-life. It is FDA approved compared to other research drugs that sometimes bodybuilders will opt to use. And it has synergy with L-Carnitine. Starting dose for Telmisartan would be 20 milligrams. You can escalate up to 80 milligrams if absolutely needed. And while we're talking about prophylactic drugs, the next one we have is Metformin. Metformin is the first-line treatment for diabetes or prediabetes. Now, this is one that's going to have a cascade of effects. Metformin is going to decrease hepatic glucose production. It's going to decrease triglycerides, LDL, so bad cholesterol. It's also going to decrease GI glucose absorption and decrease inflammatory factors and oxidative stress. Through this, we're also going to see improved beta cell function, increased peripheral insulin sensitivity, and increased fatty acid oxidation. Starting dose for metformin is 250 milligrams taken PM. Now, if you are to start higher, you have to understand that this can come with the risk of GI upset. And last but not least, probably the most popular amongst general population, Semaglutide is an injectable GLP-1. It is a single shot every single week, and the starting dose is 0.25 milligrams. Now, With GLP-1s and other forms of appetite suppressants, we have to respect the fact that individual sensitivity can vary greatly. And I've worked with clients on GLP-1s, on semaglutide specifically, who have found that 0.25 milligrams a week was still too intense. Now, although this can be used in individuals, and I see it oftentimes in the bodybuilding space used for individuals who are not technically who it is FDA approved for, it's something that we need to be very cautious about, because with that appetite suppression, what you have to keep in mind is that there is a responsibility to ensure that you are still nourishing your body and you're eating enough so that you don't end up losing muscle. Because realistically, if you're using this in order to shed body fat, if you're trying to attain a certain aesthetic, it's probably not an aesthetic that comes out to a net wash on account of 2, 3, even 5 pounds of muscle gone. Listen, all of these come with complexities. None are magic bullets. And all of these have some degree of risk, even with that said starting dose. You really shouldn't use these unless you are working with a medical professional, and the starting dose needs to be tailored based on your needs and your sensitivities. Taking random advice from the internet is a surefire way to end up either in the ER, end up sick, or end up looking worse or feeling worse than you already do. As always, thank you guys for watching. If you're interested in one-on-one assistance with any of these supplements or other supplements, link to that can be found in the description down below. Thank you for watching, and I'll see you in the next one.